Good morning, Dr. Advani. So today our topic is regarding mouth cancer. So can you tell us how do we detect mouth cancer early and the diagnosis and how is the treatment given for mouth cancer?
In mouth cancer, first thing which all of us have to remember is that its cause is very well known and is highly preventable. We know that the mouth cancer is clearly related to the tobacco chewing, smoking. Any form of tobacco use can cause the mouth cancer. And therefore, it's so easy to give up tobacco and see that the incidence of mouth cancer goes down by 90%. In practice, this is not happening. People still think that they will not get the cancer, they still chew the tobacco, they still continue to do the smoking. Particularly in some places like Maharashtra, West Bengal, Uttar Pradesh, Bihar, chewing tobacco is very frequent. Also in Assam, almost everybody there, including the ladies and the males, they chew the tobacco, and therefore there's the highest incidence of mouth cancer in that area.
So Dr. Advani, what are the early symptoms to recognize that this may be mouth cancer?
Normally, the early diagnosis of mouth cancer is possible if the people are aware about it. And what is this awareness required? Is just to know that in the mouth, if you get some ulcer, at least rule out the malignancy. Not all ulcers are cancerous. Majority of the ulcers, they usually recover within a very short period of time. 7 days, 15 days, they recover. Normal ulcers. However, if it is malignant ulcer, it persists for months. Not only it persists, but also it increases in the size and also may also cause some amount of pain also. So that's how you can suspect the oral cancer.
So what is the treatment, the main treatment for mouth cancer?
Mouth cancer, if it is detected in stage 1 and 2, the best treatment and the most effective treatment is surgery, where the surgery is done without any disfigurement, particularly in stage 1 and 2. So therefore, I think the awareness program should really emphasize that diagnose the disease early and make sure that you get away with a small surgery. And that is what is really very helpful. The result is cure rate is more than 80-90%. However, at that stage, one must give up all the etiological factors which are responsible for the mouth cancer.
What about stage 3 and 4?
Yeah, in stage 3 and 4, you have to use a combination of therapeutic approaches. Like we do the surgery also, but then follow it up with the radiotherapy and chemotherapy and sometimes even immunotherapy.
Okay.
So, by advanced stage disease, we have to use the combination treatment.
And when you get mouth cancer, even after surgery, maybe difficult to eat, maybe difficult to swallow things. So what one can do about it? Is there any procedure or is there anything what a patient can do?
Normally, the more and more sophistication in surgical techniques, in radiation technique, as well as in the chemotherapy, is allowing us to really see that all the side effects are very reversible. So over a period of 3 to 6 months, most of the side effects are gone. However, there are some side effects, particularly of the radiotherapy, like dryness of the mouth, lack of saliva, which can cause problems. But people get used to that.
Oh, thank you, Dr. Advani.
Thank you.